Welcome to Mental Health America's 2020 annual conference.
Young people continue to be disproportionately affected by both anxiety and depression, but different populations are all affected and cite some differing reasons for their concerns.
We're finding that somewhere between 2 and 3 times as many people are reporting symptoms of depression, anxiety, grief, stress, and worry than would be under quote unquote normal circumstances.
People don't know this history. I try to live so that those lives that were lost that evening were not in vain. And, I find myself ensuring that I give not only those individuals some voice in life, but also, the George Floyd, Breonna Taylor's, Ahmaud Arbery's.
We're seeing public health in action. It's just like we all collectively have to wear a mask, right? If I wear a mask and my neighbor doesn't, it's not as effective. That is what we mean in child abuse prevention.
I think everybody, if it's not you, it's somebody you love or somebody in your family, in your community, or in the workplace, but we're all living with mental health conditions. And 2/3 of those are doing so in the shadows.
These mental health concerns can affect other behaviors, such as those that involve prevention efforts, like engaging in testing for COVID-19.
My family and I were kind of stuck in our phase of grief, and we didn't know how to keep walking forward. And someone came to us with the opportunity to walk in the AFSP overnight walk. It was a great process for us, and it was a great way for us to learn how to walk with our grief.
Our society, including the medical profession itself, does not do enough to recognize the real cost that this work can inflict upon the mental health of the caregiver.
In 30 years, you've had the same routine. This is your first time you don't, so that's why it's much more difficult for you. And I didn't want to hear it. I was like, no, I'm done. I can't even think. But she's absolutely right. So once I got back in here, it really did help me.
The CDC has shown that, these disproportionate impacts are ultimately resulting in not only these disparate impacts, but also in higher numbers of death in these QT-BIPOC communities.
This goes way back to our commitment that Blue Cross and Blue Shield made, a long time ago to make sure that, we were providing everything that we could to our own employees and to their families.
It has become, the sort of hope that I get from it, and the lessons that I'm learning are everybody has something to give. And there is a lot of goodwill out there right now.
A lot of my residents, a lot of my fellows had to make the extremely hard decision to send their children away to live with relatives out of state. And couple that with the uncertainty of what was coming, they were doing that, not knowing when they would see them again.
With that in mind, the time is now to invest in prevention and early identification to get people the help they need and deserve.
This year's brought so much uncertainty, unrest, and anxiety along with it. And we know that the conversations we've had over the last 2 days need to continue. You will not want to miss next year's annual conference, scheduled for June 10th to 12th, 2021 in Washington, D.C., with the theme, From Resiliency to Recovery. We certainly hope that by then, we will be able to gather together safely in person. You can sign up for updates on the event and all of MHA's programs at mhanational.org.